Hey guys, this is Fixer Med. Welcome back to my high-yield anatomy review series for the USMLE Step 1, NBME CBSE, and NBME CAS examinations. In this series, I will be covering a broad overview of the discipline of anatomy across various organ blocks for these examinations. This will be part 48 of my multi-part video series of doing so. Without any further delay, let's go ahead and get started on today's content. Let's start off by taking a look at the parts of the uterine tube. Uterine part pierces the uterine wall to open into the uterine cavity. Isthmus, the narrowest part of the tube located just lateral to the uterus. Ampulla, the medial continuation of the infundibulum, making up about half of the uterine tube. Common site of fertilization. Infundibulum, funnel-shaped expansion at the lateral end, fringed with fimbria. Overlies the ovary and captures the oocyte at ovulation. Let's next take a look at hysterosalpingography. Hysterosalpingography involves instilling viscous iodine through the external O's of the uterine cervix, which allows visualization of the cervical canal, uterine cavity, and various parts of the uterine tubes on X-ray. Let's next take a look at the foramina of the base of the skull and cranial nerve exits. 1. Cribriform plate, ethmoid bone, olfactory nerve, CNI. 2. Optic canal, sphenoid bone, optic nerve, CN2, ophthalmic artery. 3. Superior orbital fissure, sphenoid bone, oculomotor nerve, CN3, trochlear nerve, CNN4, abducens nerve, CN6, and ophthalmic branch of trigeminal nerve, CNV1. 4. Foramen rotundum, sphenoid bone, maxillary branch of trigeminal nerve, CNV2. 5. Foramen oval, sphenoid bone, mandibular branch of trigeminal nerve, CNV3. 6. Foramen spinosum, sphenoid bone, middle meningeal artery. 7. Internal acoustic meatus, temporal bone, facial nerve, CN7, vestibulocochlear nerve, CN8. 8. Jugular foramen, temporal and occipital bones, glossopharyngeal nerve, CN9, vagus nerve, CNX, accessory nerve, CNN, internal jugular vein. 9. Hypoglossal canal, occipital bone, hypoglossal nerve, CN12. 10. Foramen magnum, occipital bone, medulla oblongata, spinal roots of accessory nerve, CN10, vertebral arteries. Please note, the cribriform plate is crucial for the sense of smell. The optic canal is vital for vision and includes the ophthalmic artery. The superior orbital fissure allows multiple cranial nerves to control eye movements and sensation. The foramen rotundum and foramen oval are pathways for trigeminal nerve branches, essential for facial sensation and mastication. The internal acoustic meatus involves hearing and balance. The jugular foramen is significant for multiple nerve exits and major venous drainage. The foramen magnum is the largest opening, allowing passage of the brainstem and spinal cord. All right, guys, now that we have covered all of the content, let's go ahead and take a look at some questions to review the knowledge you have gained so far. A 30-year-old woman presents to the emergency department with severe lower abdominal pain and vaginal bleeding. She reports a positive pregnancy test 2 weeks ago. An ultrasound reveals an ectopic pregnancy. In which part of the uterine tube is an ectopic pregnancy most likely to be located? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. The correct answer is D, ampulla. The ampulla is the longest and widest section of the uterine tube and is the most common site for fertilization. Consequently, it is also the most frequent location for ectopic pregnancies to occur, as the fertilized egg can implant and begin to grow in this region before it reaches the uterus. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A. Infundibulum. While the pregnancies. B. Isthmus. The isthmus is a narrow segment of the uterine tube adjacent to the uterus. While ectopic pregnancies can occur here, it is less common than in the ampulla. C. Uterine part. This is the segment of the uterine tube that passes through the uterine wall to open into the uterine cavity. Ectopic pregnancies in this part are rare compared to the ampulla. Cervix. The cervix is not a part of the uterine tube. It is the lower part of the uterus. Cervical pregnancies are extremely rare and not related to the uterine tube. All right, now that we have covered this question, let's move on to look at the next question. A 32-year-old woman presents to the fertility clinic after 1 year of unsuccessful attempts to conceive. The physician recommends a hysterosalpingography, HSG, to evaluate her reproductive anatomy. Which of the following best describes the primary purpose of this procedure? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. The correct answer is B, to assess the patency of the fallopian tubes. Hysterosalpingography is an X-ray procedure that involves the injection of a contrast dye into the uterine cavity through the cervix. It is primarily used to visualize the lumen of the uterine cavity and the fallopian tubes, helping to identify blockages or abnormalities that could affect fertility. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A, to visualize the endometrial lining for signs of hyperplasia. While HSG can provide some information about the uterine cavity, it is not specifically used to diagnose endometrial hyperplasia. Endometrial biopsy or ultrasound is typically used for this purpose. C, to measure the thickness of the myometrium, HSG does not provide detailed information on the thickness of the myometrium. This is better evaluated using ultrasound or MRI. D, to detect ovarian cysts. HSG is not designed to visualize the ovaries or detect ovarian cysts. Ultrasound or MRI is more appropriate for evaluating ovarian structures. E, to evaluate cervical mucus production, HSG does not assess cervical mucus production. This is usually evaluated through physical examination and other fertility tests. All right, now that we have covered this question, let's move on to look at the next question. A 45-year-old man presents with difficulty swallowing, hoarseness, and a loss of gag reflex on the right side. Imaging reveals a lesion at the base of the skull. Which foramen is most likely affected, leading to the patient's symptoms? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. The correct answer is C, jugular foramen. The jugular foramen transmits the glossopharyngeal nerve, CN9, vagus nerve, CN10, and accessory nerve, CN11. Lesions affecting this foramen can lead to symptoms such as difficulty swallowing, dysphagia, hoarseness, and loss of the gag reflex due to involvement of the glossopharyngeal and vagus nerves. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A, foramen oval. This foramen transmits the mandibular branch of the trigeminal nerve, CNV3, which is involved in mastication and sensory innervation of the lower face, not the functions related to swallowing and vocalization. B, foramen rotundum. This foramen transmits the maxillary branch of the trigeminal nerve, CNV2, which is responsible for sensory innervation of the midface, not associated with swallowing, hoarseness, or gag reflex. D, hypoglossal canal. This canal transmits the hypoglossal nerve, CN12, which controls tongue movements. While damage here can cause issues with tongue movement, it does not account for the hoarseness and loss of gag reflex observed in the patient. E. Superior orbital fissure. This fissure transmits the oculomotor nerve, CN3, trochlear nerve, CN4, abducens nerve, CN11, and the ophthalmic branch of the trigeminal nerve, CNV1. These nerves control eye movements and sensory innervation to the forehead and eye, not the symptoms described in the patient's presentation. All right, guys, that is all I have for the video today. As always, be sure to leave a like and subscribe to the channel for more videos like this if they are beneficial to you. If you have any questions, comments, or concerns, please feel free to type them up in the comment section below. Anyways, guys, this is FixerMed signing off. Be sure to have a great day, everyone. Good luck studying as always, and goodbye.